and welcome to the 6th session of the 15th Annual McKnight's Online Expo. You're tuned in to Hidden Risks in your current COVID safety and vaccine program. I'm McKnight's Long-Term Care News Senior Editor, Kim Marcellus, and I'm moderating today's event. We'll introduce you to our speakers in just a moment, but first, we have some housekeeping matters to take care of. Today's slides are available for download. Just click on the Handouts tab on the left side of your screen to find a PDF of the slide deck to print. If you're having any audio problems with this broadcast, please first check the volume control on your device, as this is the most common cause of hearing problems. Please note that the sound is coming from your computer speakers. We will have time for a Q&A segment near the end of the presentation. If you have any questions, please feel free to type them out and submit them to us, starting now. Those we don't get to in real time will be answered afterward by our presenters. Now, regarding continuing education. This educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards. It has been approved for 1 clock hour. However, you need to stay tuned into this event for its entirety during the original broadcast in order to receive a certificate. You can track CE requirements through the course completion tracker, which is accessed through the last icon in the area below the open webinar panel. Once you have achieved 50 viewing minutes, a View Certificate button will display, and the required viewing duration will have a green checkbox. You can then view or save your certificate. A copy will also be emailed to you afterward. We'd also like to note that this program is made possible by support from Hub. Visit their COVID resource website at hubinternational.com/coronavirus. Finally, this session will be archived and available on demand shortly after this live broadcast. You can access it again, or others can experience it for the first time by simply going to the registration page and re-entering the Expo Studio. The URL is www.mcknights.com/March2021 Now, let's meet our speakers. Pete Riley is the North American Healthcare Practice Leader for Hub International. He directs and coordinates Hub Healthcare's planning, growth, and strategic initiatives, and also works with other leaders and experts within Hub to develop products for healthcare organizations and providers across the care delivery spectrum. Pete will be introducing you to today's other speakers, Carrie Cervini and Jordan Parnell from Hub, and Rick Poirier from Blue Williams, LLC. Pete, over to you.
Thank you, and good afternoon to everyone on the East Coast, and good morning to those on the West and everyone in between. As Kim said, my name is Pete Riley, and we are proud and really happy to be here with everyone today. Obviously, the COVID issues that have dominated the news headlines certainly have made our last year of existence quite remarkable, and those of us in healthcare really almost every single day what comes next. I'm really pleased to be joined by two of my colleagues, Carrie and Jordan. Carrie, one of our health law and compliance experts across the company, and Jordan Parnell, who is one of our segment leaders in the senior care space for Hub International, as well as Rick Poirier, who was kind enough to join us from the Mandeville, Louisiana office of Blue Williams. And we hope what today will be, in part, is not so much to continue any white noise or bad news about COVID, but intended as an educational session to simply raise questions that we believe are appropriate and necessary for senior care organizations across the country and even into Canada or anywhere in the world, quite frankly, that if nothing else you take away from today, the ability to ask some more intelligent questions within your organization so that we can take care of our healthcare population and those that we serve quite well, if I may be editorial for a moment. So if we can move on, the agenda today, as what we intend to cover, we've tried to break this out into 3 general areas. One, I'm going to ask Carrie to speak to employment law considerations, which I think are often overlooked at this point with the very basic questions of, hey, is the vaccine appropriate? Can I mandate it? What do I do if people don't want or unwilling to participate in any program? transition that into Rick's area of expertise of the professional liability considerations, only the third party of what could go wrong from those who sadly may try to take legal action. And then lastly, Jordan will jump in periodically now and again as to how does the insurance world look to address this to help protect organizations with all the complexities that are around the simple issues of COVID and the entire vaccine rollout. And so that's where we will start. If there are questions, again, we will continue to monitor the box. And I will also say in this age of COVID, if we have some technical difficulties, please blame me. I take responsibility for that. We are trying to do this from 4 different locations. And so please bear with us. But with that, Carrie, can I ask you to start again to talk to, again, I will remind the audience, this particular aspect where we're starting this is really from an employment law perspective, first party, meaning you as employers and your staff and people who are trying to take care of your population. How do you begin to look at the question of COVID, the vaccine, and all these sort of HR, if you will, components that are really complex in an era of a global pandemic? Carrie, could I ask you to chime in?
Thank you very much.
Here
Absolutely.
I'm perfect.
Happy to join. I am apparently the living, breathing illustration of technical issues today, so wish me luck. But welcome, everyone. Welcome to our session. You know, Pete, you made such a good point in your intro that the employment law components are all as complex as healthcare, especially when you have residential healthcare. There are so many resident complexities and considerations and issues. Well, it's for a reason, because you're so busy being an amazing, high-end, high-quality cobbler that you may not be making your own shoes. And we see that illustrated time and again in high-risk industries with respect to employment law. So I thought one of the ways to kick this off would be to put vaccines in the workplace in context. Because when you look at vaccine history, guys, it really is quite remarkable. And we have a little timeline here on the next slide, that vaccines are relatively new when you put them in context, right? So I want to talk about, when did we first start having conversations around mandating vaccines? When did we start thinking about vaccines in the workplace? Well, the first mandate really in the schools. So interestingly, while healthcare is the most progressed with respect to mandatory employee programs, they originated in schools. So the school districts and the educational industry have the most experience for vaccine programs all the way back to 1827. But what was really remarkable to me on this timeline, but is the 1997 date. We didn't see the flu vaccine until 1997. Well, employers didn't really start on-site vaccination programs until the flu. So we're years have employers become involved in the vaccine conversation and the vaccine process. So when you layer on top of that the fact that we're under emergency use authorization, layer on top of that national pandemic, the experience of COVID and the vaccines for COVID, and you've got yourself quite a stressful environment for your employees, and a stressful environment for you guys as employers trying to make the right decisions around whether or not to mandate the vaccine in the workplace. So that's where we are today, and I think history lessons can also often be instructive when it comes to how do we proceed going forward and what do we do going forward. So what is emergency use authorization? I think it's important to level set that as well, because as we think about whether or not we want to motivate, mandate, or educate when it comes to the vaccine, emergency use authorization is important to understand. And a lot of you probably already know that vaccines in the workplace happen pretty regularly, especially in healthcare. We see Hep B, we see flu shots, but none of those vaccines historically have been under emergency use authorization. So we really don't know what the court's willingness will be to support an employer's workplace vaccination program. And in fact, the FDA emergency use authorization designation requires very specific notice to a vaccine recipient around the status of emergency use authorization, what it means, and the risks associated with the vaccine. There's actually a really terrific FAQ on the FDA website around emergency use authorization and what it means. But we've never before seen a mandatory vaccine program for a vaccine that's merely under emergency use authorization. So for those of you on the phone that are interested in a mandatory vaccine program, it's really important that you consult with experts in the industry, especially counsel, on whether or not we believe the courts will support it. There is a test case out there, not surprising, but there's a case in New Mexico, and an employee is suing her employer on the theory that emergency use authorization is prohibited or prohibits an employer from mandating the vaccine in the workplace. So a lot of this, as you can imagine, continues to be stay tuned, but part of our program today, we want to create awareness and education around some of your important considerations. The last consideration that I want to kind of hit before we start getting into what's going on in the world with vaccines and litigation and healthcare in particular is the Joint Commission. So when I was building this deck, the first thing I thought was, well, gee, what does Joint Commission have to say about this? Because they are the industry standard. And they have not taken a position on vaccines at this time. They're not really advocating for clients or for healthcare organizations to vaccinate or not vaccinate. They're really deferring to the CDC and OSHA, and the emphasis of Joint Commission right now is around safety and safety protocols. Now, when you look at the CDC and you look at OSHA and you look at their guidance, they are very heavily advocating for vaccines and vaccines in the workplace. In fact, 2 days ago, the CDC just published a new webpage on vaccines in the workplace and guidance and suggestions for employers and employer vaccination programs. And it very much falls heavily on the side of motivate and advocate for your employees to receive the vaccines. It does not go as far as mandate, but it definitely hits on motivate and educate your employees to receive the vaccine. But remember, guys, whatever you do, safety continues to be number one priority. Mask mandates, mask requirements, safety practices, social distancing, all of the safety protocols that in many of your cases you've lived with the entire career in your industry, but for a lot of the administrative folks and less patient-facing folks, these safety protocols still must remain in place. So that's your foundation. Let's switch our attention now a bit to what's really happening with respect to COVID risk, employers, and litigation. So there's a couple of really nice national trackers. The one that you see in front of you, and guys, this is pretty much available to you on the internet. I found myself. This is the Fisher-Phillips Interactive Litigation Tracker. You can see on the right-hand side the little expansion buttons for each state. You can filter this by industry. You can filter this by state. High-end litigation tracker. And I want to draw your attention to a couple of points here because there's going to develop. The total cases filed since the end of January are 1,600, most specifically in healthcare. So for everyone on the phone today, your industry is really the starting point, or I hate to use the phrase ground zero, but you are the central point of litigation across industries. The other thing that I want to draw your attention to on this chart is that most of the litigation that we're seeing at the federal level is remote work and leave conflicts, which makes sense. Families First Act, emergency paid sick leave, FMLA, all of those kinds of leaves are regulated at the federal level. Now, when you drill deeper, you start to see that the most common litigation that's happening on the next page is really around whistleblower. And this is where I want to spend a little time. Retaliation and whistleblower are the most common forms of litigation at the state level in healthcare, which makes sense because the federal claim for whistleblower would be an OSHA complaint, not a lawsuit. So it makes perfect sense that when you fold in the state litigation statistics, retaliation and whistleblower appears for almost every employer segment or every employer size as the number one form of litigation. And the best way for me to explain or talk about this, I think, is by example. Guys, I read case after case after case of nurses, safety directors who raised their hands through COVID to leadership in the organization and identified breaks with safety protocols, breaks with COVID safety protocols, exposure cases, lack of PPE. We certainly heard a lot about lack of PPE in the beginning. And these employees, instead of being applauded for bringing it to the employer's attention, were summarily terminated. And it happened over and over and over again. And it may be that in some of these cases, the employee really was on a collision course with termination anyway, and they happened to have engaged in a protected activity and blew the whistle on the safety issue. But regardless,
Carrie, it's Pete. Let me ask you a quick question to that. And pardon the interruption. And a question has just come in, and I think is appropriate to where I think your comments are going. Are there some best practices that we can recommend in this limited time frame, but that employers should be aware of or utilize to help reduce that exposure to litigation? And or are there other things they can do to minimize the potential for whistleblower? I realize there's no way to stop it, but I think your point being it's an enormous potential exposure. Are there some basic things we can guide them to suggest they undertake now?
Yeah, absolutely. It's such a great question, Pete. Thank you for asking it, and to whoever submitted the question. There's a real foundational, easy answer here, and then the execution of that answer gets a little bit more complicated. But take the complaint seriously. If somebody raises their hand and says, hey, I've got a concern, we've got a COVID patient, we've got exposure. One of the cases that I read, for example, there was a COVID patient and there were doctors and nurses exposed to the COVID patient and nobody had PPE and nobody informed the doctors and nurses of their exposure. Another case where a visitor had COVID symptoms and ultimately tested positive for COVID, and the visitor was allowed to walk through the facility without PPE. And it's example after example like that where employees raised their hand and employers didn't take it seriously. So regardless of the that tend to be complainers, I know we have those employees that tend to be louder than others. Regardless, this is the time to take it seriously. And maybe you'll identify a practice in your workforce or a break in the chain in your safety protocols that you can address and respond to prior to any kind of action. This is a great time to look at whistleblower services. There's all kinds of whistleblower hotlines out there. Fantastic time to look at those whistleblower services. And if you guys will jump to slide 13, because I think we've covered the litigation landscape nicely to Pete's point. One of the things that I want to identify for everyone on the phone is that you have an absolute obligation to put protocols and systems in place associated with negligence, preemptive strikes to negligence claims on the next slide. So this is a great time to review your safety protocols, review your safety policies, test them, audit your systems, audit your operations, audit your processes, audit your people. All of these activities, to your point, Pete, go to your duty to provide a safe working environment and put you in a very defendable position in the event somebody tries to claim that you breached that duty. Being able to demonstrate audits, policies, enforcement. I had a client call me a couple of weeks ago. They said, Carrie, you'd be so proud. We listened to your program. We put our safety protocol in place. And I said, great. Are you enforcing it? What do you mean enforcing it? I said, are you enforcing your safety protocols? If Bob didn't wear his mask for the 5th day in a row, did you write that up, for example? Poor Bob. I pick on Bob in every work program up. It's very important that you enforce these safety protocols and you hold people accountable. If you pay attention to duty and breach, you'll protect the business. Now, I see a question about...
Carrie, let me stop you there for a second, because I think, knowing two attorneys on the phone, and if I've learned anything from being around attorneys, you never ask a question you don't know the answer to. So yes, this is a setup for you and or Rick. Is it safe to say, as you said, to have the documentation is not only critical, but the enforcement? Is consistency a word that we could say that is terribly important? And Rick, you who then gets to the courtroom, who have to defend these, is it something as simple as that? I'm not saying it's easy in the workplace, but is consistency vital to when you do the documentation, you do the protocols, procedures? Isn't that vital?
100%.
Absolutely.
Go, Rick, go.
Sorry, Carrie. That was an easy one, Pete. Absolutely is my answer to that.
Can you speak to where that breaks down periodically, though? Because it is, again, it's a simple answer, but we all, Jordan, myself, two of you, have seen where it doesn't happen. Where does it begin to break down, do you think, so that the folks on this call can understand it's nice to have a document, it's nice to put it in a folder. How do you consistently enforce it?
So I'll hit the employment piece and then hand it off to Rick. If you'll go to slide 14, you'll see that from the OSHA agency standpoint, not only have we seen the civil litigation that you saw in the previous slides, but you'll see the monumental amount of whistleblower complaints to OSHA directly. And to your great question, Pete, oftentimes this is because of the breakdowns. Have you trained your managers on how to hold employees accountable? Performance management is one of the most uncomfortable things. We all know our managers hate doing performance reviews. We all know our managers hate writing people up. This time that we're in today has made it more critical than ever to provide manager training around their obligations as a manager, the liability that their acts and omissions create for the organization, and the importance of enforcing these policies, both from a private civil standpoint and from a standpoint. Rick, you want to hit that too?
Well, I was going to say in response to Pete's question, where the breakdowns happen. The breakdown, I believe, happens more often than not due to complacency. People are tired of wearing masks. People are tired of having their temperature taken when they walk into a facility. But it has to be done, and it has to be enforced. And management needs to make sure it is.
I'm sorry, Rick. I'll tell you what I see a lot too is Sally. She's such a troublemaker. She's such a complainer, and it's sort of like Chicken Little, right? Managers and leadership get tired of the same people voicing their concerns, and a lot of the cases that I've read have been that exact scenario. You've got the employee that raises their hand on a regular basis, and after a while, people stop listening. And to Rick's very good point, complacency, you get tired of it, you shut it out, you don't want to hear it anymore, and before you know it, OSHA's knocking on your door, or you've got a plaintiff lawyer banging on your door. Just as a side note for everyone on the phone, the Recovery Act, the Rescue Act that was just passed, includes somewhere in the ballpark of $100 million for OSHA. OSHA's hiring like crazy. The Office of Inspector General issued a report pretty much blowing up OSHA for not launching timely investigations and not having enough people in the field enforcing OSHA protocols and OSHA safety protocols, healthcare and manufacturing industries. So the risk is real, and the spotlight of the healthcare industry is pretty significant.
And let me just for a moment, Carrie, you cut out just briefly, and thank you, technology. What Carrie is speaking to is there's a lot of money now behind OSHA and the enforcement. And while I don't want to say it's been lax, I don't mean to take that kind of shot at OSHA. We hope one of the takeaways from this, before you get to having to hire Rick and going into a courtroom, is OSHA is beginning to ramp up its efforts. And so be mindful of that. And let me ask a question of Jordan. Jordan, if I can bring you in on this briefly, that let's be candid. Jordan, Gary, and I all work for an insurance broker. And so at the end of the day, one of the things we want to be able to do is that insurance coverage for liability is in part the security we hope to be able to provide to senior care facilities. Jordan, is the senior care underwriting community, and for those of you on the phone, those are the folks who set the prices and set the terms and conditions of the insurance coverage. Do you find this type of consistency, this documentation, is resonating with them, and is it increasing in importance for them when they look at any given facility?
Yes, Pete, and actually, these type of coverages would be called employment practices liability, which you most notably in the past have seen claims coming from EEOC complaints that would then resonate through litigation. But we're actually getting questions from the insurance companies prior to binding the insurance policies about the COVID response at each facility, timelines, how many active cases in the staff levels, did you follow all the procedures, all the guidelines, FMLA, and so forth. So documentation, as Rick has mentioned previously, is paramount to all of this. But yes, we have seen the insurance community react to COVID and start asking lots more questions about timelines and what procedures and policies did you take as a operator.
That's great. Thank you, Jordan. And I didn't mean to, sorry, Carrie, to interrupt, but I think one of the pieces that is important is, and I'm going to tease Rick for a moment, none of us wants to get to the courtroom with him, but when you get there and he's asking for these things, the underwriter has done much of sort of the pre-litigation work for you, if you will. And so that's why I asked Jordan, I think it is important this audience understands that no one likes to go through an underwriting exercise, but it is this documentation and consistency that is not just for litigation. There's a more immediate near-term impact on your professional liability insurance, as Jordan said, your employment practices. The ripples, I think, are like dropping the pedal in the pond. They go quite broadly. So sorry, Carrie, I didn't mean to run us off on a tangent, but certainly the OSHA and the EEOC issues are going to be with us for a while.
Oh, 100%. And, I want to also address two things with respect to insurance. And Jordan, I'm going to need your help on one of them, or maybe both of them. In the healthcare industry, most often we are seeing work comp carriers respond to workplace incidents of COVID because you're on the front line dealing with COVID patients. A lot of my clients say to me, oh, I don't want my work comp to respond. And my answer is you actually should want your work comp to respond, because workers' compensation has built into it an exclusive remedy provision that protects you from simple negligence claims. It says work comp is the only remedy unless it's gross negligence, and that's got to be a really high standard, really willful violation. So work comp responding to your COVID, we have seen so much civil action activity around health and safety in the workplace. The other thing I want to sort of address is what you see on the screen here under the employee rights and remedies under OSHA, and this is where I need your help, Jordan. If an employee blows the whistle through OSHA or to OSHA, does EPLI respond in the same way as in civil cases, or is there a carve out for government fines and penalties and that sort of thing? I feel like I know the answer, but I don't want to guess.
Every policy is a little bit different, but, the policy should respond to any regulatory issues that you have if it's related to an employee practice or liability assumed as an employer to that employee. Pete, do you know any more specifics on that question other than what I just said? I believe it would respond though.
Yeah,
I would agree with you, and I think in most instances the answer is yes, as Jordan is saying, with the possible exception of if you know it's going to be harmful and yet you still don't care, and you almost intentionally put people in harm's way, which I cannot imagine really happens in healthcare. There are always exceptions, but to Jordan's point, 9 times out of 10, 99 times out of 100, the answer is yes. But it is, again, the devil is in the details of you want to fall back on having consistent policies and procedures. And if we take away nothing from today, I think all four of us would tell you consistent policies and procedures are critical across both first-party employment law, where we're going to talk to you momentarily about third-party liability, and in just all of your risk management procedures and protocols. So I cannot think of a case, as I sit here, where it wouldn't be covered, but I'm sure, Jordan, there's some policy that might exclude it. But generally, that's what it's there for.
Yeah, intentional acts are always really tough. They're also tough to prove. So you would likely have some defense until the insurance company could prove that it was an intentional act.
Great point.
I wanted to step in there too, because I see a question that I think is a really good question for Carrie, and we got this question a lot when the vaccines were becoming available for the employees, but this is even about a mask. So she asked, what about hiring healthcare staff who have a medical or religious exemption, not to the vaccine, but to wearing a mask is what she asked, which is different than what we've seen lately. Could you as an employer be accused of violating ADA? What are reasonable accommodations? Carrie, is that something that you would want to take?
Yeah, absolutely. And great minds, Jordan. I've been staring at that question for a couple of minutes because I think it's a great question too. A couple of things to say here. First, I want to thank you guys for letting me put you on the spot on the EPLI. There was a method to my madness, and that is we've seen a lot of cases brought to civil court where the court threw it out and sent them to OSHA.
I'm afraid, technology is letting us down at the moment, that where I think Carrie was going with that is what the courts have done is pushing. Look, there she is. Carrie, we lost you for a moment.
I'm here.
If you could revisit.
I'm here.
If you could start where you left off, at the courts pushing some of the complaints, the allegations back to OSHA. That's where I think we lost you.
Yeah, their plaintiffs are disguising cases as civil cases for tort because the damages are greater rather than going to a government. So when you have a complaint about health and safety in the workplace, that's generally an OSHA general duty complaint, not a tort complaint. So that's where I was going on the EPLI component. Now to the question in the chat, which is a wonderful question. When it comes to all of these safety workplace protocols and vaccines, you absolutely have to take religious and ADA accommodations. With the masks in particular, it's been really challenging. I've had a lot of clients who have employees who have asthma, claustrophobia, other kinds of diet conditions where they could not wear a mask. And in some cases, employees were moved to non-patient facing roles. ADA does allow you to temporarily change the job in order to provide an accommodation. In some cases, they use other kinds of personal protective equipment depending on the nature of the position, like a face shield, although they're not going to be a particularly effective for ADA. You go through the interactive process, same with Title VII. You have to identify, if available, a reasonable accommodation so that the employee can perform the essential functions of his or her job. You can move into another position, and you can ask for documentation. So this is not held hostage by an employee. And sometimes it may be that there is no accommodation available. And in that case, always check with outside counsel. There is significant activity at the local and regulatory standpoint in ways that we've never seen before. So you definitely want to work with local counsel as well.
So let me ask very quickly, Rick. Go ahead. Sorry, Jordan. Go ahead.
Yeah, as we were talking, I literally just got an EEOC complaint from one of my clients where the employee was terminated, and his allegations to the EEOC is that he was terminated after reporting a COVID infection precaution violation to infection control state inspectors. So, not only is is this timely. I think, as Carrie mentioned, it's prevalent. So just interesting timing that that came up, and I just wanted to mention that as those are actually real life allegations that we're seeing from senior care operators.
Live happening now.
Right, as we talk. Rick, is it more challenging in the courtroom with what Jordan has just described in this environment? Is it a even more litigious environment in the age of COVID with issues such as this around OSHA and EEOC?
Surprisingly not yet, Pete. And that's what I think everybody is waiting for the shoe to drop. There have obviously been a few test cases, and some people are filing claims. But I think that the early months of the pandemic, which resulted in most states in lockdowns, sort of had everybody towing the line. And I think that, so most states you have at least a year to file a claim. Well, this time last year, most of the country was locked down and everybody was minding their P's and Q's. So you're not seeing the claims start to roll in that you otherwise might. I think that the claims that we are seeing, and I'll get into this a little bit in a moment, we all were very hopeful that the Public Readiness and Emergency Preparedness Act, the PrEP Act, an act which I sheepishly say I'm pretty proud of the U.S. Congress for enacting. I think it was a great measure, and I don't say that about many of the things they do. But I think the entire defense bar, and those primarily in healthcare, thought that the PrEP Act was going to be our shield against an onslaught of claims regarding COVID, from the failure to wear masks, to failure to take temperatures, the failure to or inappropriate testing for COVID, inappropriate administration of vaccines for COVID. We thought that was going to be our umbrella, and so far the courts don't seem to see it that way. The Department of Health and Human Services, the Secretary of HHS, has literally jumping up and down, stomping his feet with advisory opinions and amendments which don't have the force of law, but that are telling, presumably the courts, hey, you guys need to apply the PrEP Act. So, we haven't seen a great uptick in claims. Whether we will or not, I really don't have the answer to that.
I was going to say, Rick, if I put you on the spot as a betting man, and not meaning to do so, I will only speak from my own opinion. I think it's simply a matter of time, and that's not to take a jaundiced or necessarily pessimistic view, but I'm sorry, the plaintiff's bar has too much incentive otherwise.
Mm-hmm.
So
I think you're probably right.
Go ahead, yeah. And again, Rick, I don't want to cut Carrie off from her piece, and unfortunately we're going to put a placeholder in that about the PrEP Act, because we will revisit that momentarily. But it is, I think, something that this audience, I hope everybody, if you don't know or have a good sense of the PrEP Act, and one thing Jordan will tell you I'm very, very good at is volunteering other people's time. I would strongly recommend you reach out to one of my colleagues here and get some information about it, because it is probably one of the most important pieces to understand of what your defense may be and how it is then applied. But let me ask you, Carrie, if you can finish your part, only in the interest of time, because I do want to get to how the third-party world, meaning those who are going to sue you from the outside, will look at this. But I don't want to pass over some of the finished pieces that you may have regarding the PrEP Act, because I think it's a very natural conversation then into Rick's area of expertise.
Well, and I'll tell you, it's a great transition over to Rick and his content, Pete, because when we talk about what do we, pull out our crystal ball, what's yet to come, let's go ask the wizard kind of thing. If you look at the volume of claims to OSHA and the volume of civil health and safety kinds of claims through the state courts, I think you start to get a taste for or a sense of where litigation is going. In a lot of ways, we're all kind of in this fictitious false universe of what does the litigation look like? Because a lot of people aren't running up the courthouse steps. The EEOC had the lowest number of level in like 20-year history. But then when you start looking at the states and you start looking at the health and safety and you start looking at the areas where people are paying attention, where people are most emotional, passionate, and afraid, and that's COVID health and safety and COVID vaccines. And it took less than 30 days for our first vaccine lawsuit to be filed in the employment setting. So I think I agree with both Pete and Rick that there's a lot more to come and a lot more to say. And the only good news I have is that can be prevented, and you can build your defense long.
I'm not sure it isn't the plaintiff's counsel that is currently now deleting Carrie, who's saying the good news is, as she said, the documentation and the planning is the defense here. But I would, for this audience, and Rick, I'm going to quickly turn this to you about the professional liability exposures, but I would encourage this audience to think of COVID, the vaccine, how you apply this in an employment situation, much like we did on cyber or data security that was functionally non-existent 10 years ago. If it was something discussed, it was sort of an also-ran conversation amongst medical professionals. But now, as we know, data security, privacy, as George and I will talk about, is cyber liability, maybe a bit misnamed, wasn't a particularly hot topic. Well, that has changed, obviously. COVID has condensed that decade to a year. And as I sit here in Nashville, Tennessee, staring out at what was once a very crowded neighborhood, it is almost empty. But it's starting to open back up, which means, and I think where Carrie was going, is that the plaintiff's bar is also going to open back up. And so I would encourage this audience to take advantage of what I think is so far the lull. But Rick, if I can put you on the spot, from a professional liability standpoint, and by this we mean folks, third parties, outside folks, taking legal action against any senior care or other provider, what's your crystal ball telling you, Rick?
I think it's definitely going to happen, Pete. What really is going to drive it is whether or not either Congress or the federal courts take cognizance of the PrEP Act. Congress clearly wrote that law to preempt state causes of action. In other words, they wanted the PrEP Act to govern anything that fell under the PrEP Act. Everything related to COVID so far, since its onset and recognition last year in March of 2020, which was made retroactive to February of 2020, when we really realized, hey, we have a problem here. Everything and every step of the way in the progression, from the testing for COVID to the first NIOSH face mask, the N95s, as being approved, to the use of drugs that initially somebody thought were good to treat COVID and realized on further study and use that they weren't good to treat COVID, to the vaccines, the 3 that we have now. Every step of the way, the PrEP Act has embraced those measures, and they're called by term of art under the Act countermeasures, because that's in fact what they are. They're responses to the pandemic and to this virus. Congress wanted everything that dealt with countermeasures to be within the federal court's purview. Regrettably, the few federal courts who have faced those questions have not read the Act as intended. And that's what's got HHS all up in arms, because they think we need a federal umbrella. Why? Because it's unprecedented, certainly the pandemic, but in terms of the legal world and the operator's world, it's unprecedented to have the standard of care changed on a dime. Sure, we've had regulations from CMS and from JCO over the years that have shaped the correct practices and policies in facilities, but they didn't happen overnight. In today's world, a CDC proclamation that is then embraced by the PrEP Act becomes the new standard of care. In January of last year, it was not the standard of care to take the temperature of every individual walking into a facility. It wasn't the standard of care to require a mask on that individual. Now it is. The good thing about the PrEP Act is, despite the fact that the standard of care is turned on its ear, the PrEP Act offers limited immunity for everybody and every countermeasure under the PrEP Act, which means that not requiring somebody to wear a mask, or maybe not noticing that the mask they're wearing is a common pair of pantyhose that's protecting nobody, wouldn't necessarily subject the facility to liability, because the limited immunity under the Act would grant to the facilities and their employees a standard that has to be willful. In other words, without the PrEP Act, if you didn't enforce a mask, that's probably negligent. And in today's world, in state courts, negligence equates to damages awards. Under the PrEP Act, failing to require a mask probably is still negligence, but negligence isn't the standard any longer. You have to prove a greater violation, and that greater violation is essentially willful conduct. I mean, willful in the sense, not that you allowed it, but in the sense, I'm sorry, in the sense that you intentionally, yes.
Go ahead. Sorry, I didn't say. Did you,
oh, no. Willful in the sense that you intended to do it for a wrongful purpose or without any factual justification. So it's a greater standard that, you know, when we who represent facilities, long-term and acute, started digging into the PrEP Act, because we had to find a way, once these CDC guidelines started coming out, to start formulating our defenses and advising our clients who had the same questions that our listeners do. What the heck are we supposed to do now in this world? Well, what you're supposed to do is follow the CDC guidelines, get your policies and procedures, as Carrie said, for your employees, as well as all other residents, visitors, vendors, and anyone else who walks into your facility, and enforce those policies and procedures. You know, the common theme that... I'm sorry, Pete, go ahead.
That's a great point. The question has come in, and Michael, I think, was the gentleman who asked it. He said, you know, do you think we're ever going to go back to the old ways, if you will, the old normal, and have we been doing it wrong all along? And my initial thought was, well, we didn't know what we didn't know. As you said, the world was turned on its ear. The standard of care changed. I think it was March the 13th of 2020. For you as a defense attorney who's having to stand in front of a jury or a judge, would you say that we were doing it wrong and that we need to revisit everything we did previously, or are we really operating with the PrEP Act and those immunities and those tools? Have the rules of the game changed? Is that a fair question on my part?
I think the answer to that is yes and no. The rules have changed to a degree. They have changed in the face of what is an unprecedented world health crisis. Had we had this health crisis 40 years ago, I think the rules would have changed then. You know, unfortunately, during the first flu pandemic in 1918, we didn't have the scientific resources to combat it, to figure out how it was transmitted, to figure out exactly what it was, much less to inoculate against it. Now we have these resources. So I think, yes, it's changed to some extent, but no, I don't think that means we were doing it wrong all along. I think we've just reacted and adapted. Will it go back to normal? I think it's going to be a new normal.
Yeah, that I wholeheartedly agree with you. Jordan, let me ask you sort of that same question from an insurance and risk management standpoint. Do you think that this is a new normal now in the senior care, if I can use that phrase, to cover the entire, what used to be called the nursing home industry? Do you see it as a new normal for how underwriters and the pricing of insurance is going to impact the senior care industry?
Well, I think that a lot of these insurance companies are going to really look hard at at their business units related to senior care. And a lot of them have come to realize that if you do have any national issues like this, the probability of them hurting the senior care industry has gone up exponentially, right? So we've all seen that there's a weak point in the senior care industry because of how acuity issues, just, a lot of end-of-life type residents are in these facilities that have a lot of various health issues that are comorbid. And, anytime you have any type of crisis like this or similar, or, any of the ones in the past like swine or Ebola or, whatever's going to come next time, will be susceptible. So I think a lot of the insurance companies are taking a hard look at the senior care industry right now, if that answers your question.
It does, and it leads to sort of then a subsequent question for you, Rick, that you working with insurance companies, defending these facilities in the worst of actions, do you see a change in appetite from the insurance companies? And it may be too early for this, but are they saying, short of willful, we are going to utilize the PrEP Act. We are going to take these affirmative defenses, if you will, to protect this industry that happened to be, catch this one, all my analogies are sports analogies, so I apologize to those who are not baseball players or fans, but to take one in the teeth from a pitcher. I mean, no industry, I think, was more immediately impacted than yours. Rick, do you see the insurance community understanding the need to dig in and fight some fights using the PrEP Act and other tools to defend this industry for, as you said, they're not willful misconduct, but rather it's a new age?
I do. I certainly do, Pete. In the handful of cases that have made it to reported decisions thus far, Kansas, Florida, New Jersey, they've all been state law claims. So residents or decedents or the surviving family members will file a lawsuit under state law cases, just like we see every day. You didn't follow your policies and protocols. You didn't have PPE in place. You didn't follow your infection control standards. Those are all state law causes of action in virtually every state in the union. They vary slightly from state to state. The defendants in those cases have gone in and removed the cases from state court, saying, look, the PrEP Act covers all this, so we're going to federal court, and the federal courts need to apply the PrEP Act. Each one of those cases has had a federal judge say, but they didn't plead under the PrEP Act. They pled state law causes of action, and we do not read the PrEP Act to preempt, that is, supersede these state law causes of action. Therefore, we don't think we have jurisdiction. And they've returned these cases to the state courts. That has prompted the Secretary of Health and Human Services to issue an advisory opinion, which unfortunately has no force of law, where they emphatically disagree with each one of these decisions, specifically addressing them on their merits to say, look, this is something that cannot have varying results depending on your venue. Anything under the PrEP Act needs to be heard by a 3-judge panel in Washington, D.C., because it's that important. Nobody knew any more than the other person when this whole thing started. We're all in it together, and it needs to be consistent. And I'll tell you how earth-shattering that is from a legal perspective. Every state in the union has folks who don't wear seatbelts. It didn't used to be against the law to not wear a seatbelt. It is now. Cars always had them. But the federal government did not come out with a law saying everybody in every state has to wear a seatbelt. They coerced it through withholding of highway funds. This PrEP Act is the federal government saying, hey, if we deem this to be a national emergency, everybody has to play by the PrEP Act rules. And unfortunately, they might not have written it as clearly or sternly enough for the courts to take that. But that's what it's meant to be. And if that, in fact, is what it ultimately is determined to be, then the cases are going to start dropping by the wayside. Because, number one, the plaintiff's bar is going to be dissuaded faced with that high burden of proof, not to mention the fact that the only venue in which it can be prosecuted is before a 3-judge court in Washington, D.C. So this is just legally groundbreaking to have a federal statute that basically says the only shot you have to recover injured resident, injured vendor, injured visitor is through this federal act, period. We don't have anything else
Terry,
like
it. Sorry, Rick, thank you. And that, folks, I think if there's one of the key nuggets and takeaways from this, I think that's part of it. And I don't think the plaintiff's bar is being cute. I don't mean to, besmirch the plaintiff's bar. I don't know of any fans on this panel that are happy with them. However, it is the proper application of the law once the PrEP Act, I think, is fully up and running, if you will. Carrie, is that a fair, and only in the interest of time, I know we're coming close to the end, do you share Rick's opinion about how the PrEP Act will address, from an employment perspective, offer that same sort of uniformity of application of the law?
So I am not whether or not the PrEP Act uniformly applies to the employment setting, because the employment relationship is protected and regulated by other government agencies that have their own eliminations of immunity, like the general duty clause of to that. That's a standard obligation. We've got emergency temporary standards that we expect to be issued any time now that will be incumbent upon employers of all industries, depending on the nature of the risk of the job. So I think PrEP Act applies in Rick's world in a much more clear, significant, and understandable way than in the employment setting. And I don't think employers are going to be able to seek protection. I can't say for sure because, this is all evolving as we go. But Rick, do you think that's a fair assessment of the difference here?
I do. And to be honest, given all of the writings so far out of the HHS, I have not seen one inkling that it would apply or that they think it applies to the employee-employer relationship.
You're going to see DOL and OSHA there.
And if I might, and first off, in the interest of time, unfortunately, we've got to put a bow around this. I think, and I want to thank my fellow panelists for doing a lot of the legwork. I got to ask all the silly questions as they hit me as I paced in my hotel room. But I hope the takeaway that we want to bring to everyone here, really on 3 fronts. One is the need for consistency and documentation is going to matter, first party or third party. And as Jordan and I live every day with the insurance company, with the underwriters who are going to provide the insurance to allow facilities to continue to operate as they're required to do licensing and everything else. And then really 2 separate and distinct, and Carrie, Rick could not have, and we practiced this call once or twice, we never went down this path, but it's absolutely spot on. While the PrEP Act is vitally important for every facility and provider to understand, to Carrie's point, it only goes so far. And while it may be a great tool in Rick's world, and one that everybody on this call should know a little more about, because it is, I think, affirmative defense, Rick, fair statement to say the PrEP Act can be an affirmative defense in certain instances? Am I overstepping
it
my
can,
bounds?
and I mean,
Got it.
I would encourage everybody to continue to use it as a basis for removal until the federal judiciary heeds the advices of HHS. I think ultimately it's going to happen, and if it doesn't, I think Congress is going to have to act again.
Well, and that being where the industry then needs to act with a uniform voice. But to the second piece, and it was a question on purpose, I think some people have overstepped thinking the PrEP Act is going to govern the employee-employer relationship. And as Carrie can tell you much better than I, it doesn't, or it might not. And so those 3 things, if nothing else, we hope that continue to raise the questions within your organizations that this is a game-changing issue. with COVID, and the vaccines and how they are going to be utilized and whether or not utilized. And someone took a religious objection. So that is a long-winded way of saying there are three very distinct pieces we hope you take away from this, but sadly it is a topic that the four of us could talk about for hours and probably is not going to be sufficient in this hour time frame, but wanted to make sure we at least had a little bit of time left to talk about questions and or other items that may have come in.
Yep. Clarity and
Thanks,
consistency.
I was going to say, it looks like we did manage to get to most of our questions. This is Kim speaking. Any questions that weren't answered, we will absolutely have our presenters get back to you on that after the webinar. But we do need to wrap it up. Pete, are you ready for me to give our thank yous and give our further information to our listeners?
Yes, please.
Okay. Well, first of all, thanks, Pete. Thanks, Carrie, Rick, and Jordan for that very informative presentation. I know I learned a lot, and this is something I write about often, so appreciate your insights here. So again, we've covered most of the questions, and we just want to say thank you very much. If you'd like to rewatch this session, it will be available soon, again, within the McKnight's Online Expo environment. We'd also, again, like to thank our sponsor, Hub International. As a reminder, you can find more COVID-19 resources at hubinternational.com/coronavirus. And finally, we want to thank you, our listeners. You've been a big part of the success of this year's Online Expo so far. Please consider joining us for our final presentation at 3:30 p.m. Eastern. That's the next steps, pharmacy-provided vaccination services in long-term care. And you also have until 4:30 p.m. Eastern to check out our booth, where you can still gather resources and enter to win prizes. So we look forward to seeing you again at future McKnight's webcasts, and please keep an eye out for those at our McKnights.com events tab to find out all of our online offerings. This is Kim Marcellus for McKnight's. Have a great afternoon, everyone.